Welcome to Spilling the Tea with Dr. Joyce, a podcast that goes deeper than the highlight reel on social media. I'm Dr. Joyce Park, a board-certified dermatologist, content creator at Tea with MD, and founder of Skin Refinery Dermatology Clinic. Each week, I will be joined here by a remarkable guest, and together we'll discuss stories and strategies for balancing our challenging careers with our personal relationships while making time for beauty routines and self-care. So grab your favorite cup of tea, get comfy, and let's get ready to spill the tea together. Hi, everyone. Welcome back to another episode of Spilling the Tea with Dr. Joyce. And I have a super special treat for all of you today because our guest this week is none other than Dr. Natalia Calloway, who is an amazing ophthalmologist, but also one of my best friends from Stanford Medical School. Welcome, Dr. Calloway.
Thank you so much for having me, Joyce. I am one of the original Tea with MD followers from the days of New York, and I think that's my greatest achievement.
You're too kind. So I put together a little bio for you so that everyone can know just how amazing you are. So I'm just going to read this off before we dive into the questions. All right. So Dr. Natalia Calloway is an ophthalmologist, researcher, Stanford University faculty member, and industry leader at Genentech, and one of my best friends from Stanford Medical School. Dr. Calloway was born in Poland and grew up in wine country, California, attended undergraduate at Johns Hopkins University, where she also played volleyball, and got her MD and a master's in health research services from Stanford School of Medicine. She completed ophthalmology residency at the top-ranked Bascom Palmer Eye Institute and completed a retina fellowship back at Stanford Byers Institute. Not only does she lead teams bringing medications from bench to bedside and designing clinical trials at Genentech, she also has time to publish over 70, peer-reviewed publications, and is mom to 2 girls, 1 little boy, and is currently pregnant with her 4th child. Natalia, you never cease to inspire me in our decade of friendship. So welcome to Spilling the Tea.
Thank you. I'm very much looking forward to spilling the tea because when we read it from the CV, it looks very glamorous, but the day-to-day is a lot of on the go, kind of on the spot, pivot, adjustment, and moving forward. So I'm really grateful for this episode and couldn't be happier to be here.
Thank you. I'm so excited to hear all of the pearls that you have to offer. And I always like to start at the beginning. So as I mentioned in your bio, you were born in Poland and then you immigrated to the States. Can you tell us a little bit about what that was like transitioning to life in a whole new country?
Yeah, so I think that's kind of like my party fact whenever people say, is there something people wouldn't guess about you? It's that I'm a refugee. I was born in a country that was in political turmoil, communism. It was behind an iron curtain, and I was very young during it. And so really, I think the applause should go to my parents. They were very brave. They decided to come to a new country that they didn't speak the language. They grew up learning Polish and Russian, but they took that risk for a better life. And I was primarily raised here, but raised with that kind of immigrant, new, non-English speaker mentality. And I'm very grateful for it because I saw firsthand how hard people work for their dreams, what the American dream really can be. But also, the real struggles that come along with that. And working with parents that really didn't crystallize their English until they were I was in 7th or 8th grade. I'm the first child. I was the only one born there. And I remember helping my parents translate things with tax forms and at the cashier and at the DMV. And I think a lot of that relates to my drive to go into healthcare and hopefully kind of help bring not just health education, but also literacy and access to all sorts of people that all of us need health.
Yeah. And I think your story of growing up with immigrant parents really resonates with a lot of people. And I know that's something we connected over back in medical school as well. And yeah. Growing up, I did the same. I would help translate forms for my parents. I remember my dad having to write reviews for others of his employees at work, and I would be proofreading them and helping him write them. And it really, it really gives you a firsthand look at how hard your parents work and how hard immigrants work to achieve the American dream, like you were talking about. And all they do is really in hopes that the next generation can have those dreams be more attainable. So
Yeah,
um, I
exactly.
can definitely see how that translates to your drive for medicine. So when did you decide that you wanted to be a doctor?
Well, right along those lines, I decided very early because we had an amazing pediatrician. So we moved to a farm area. It's wine country, but when you live there, it's actually agricultural in Northern California. And there was no other Polish speaking family that we knew of. So my parents were really quite isolated. And when we would go to our pediatrician's office, unlike everyone else that would essentially kind of just say it in English, whether my mom understood or not, you got to move on. This pediatrician, this is back in the day when there was no internet translation services. There's not even cell phones. So I'm like aging myself here. And she would call in manual phone line to UCSF to get the Polish translator on the line to make sure that my mom understood what was going on with each of us after every visit and that her questions were answered. And I just thought, Dr. Green, that's her name. I hope that she gets credit for this someday. I was just like, this woman is, I mean, what a career, what a thing to do for other people. And so I was so inspired. I think at 7 years old, I told everyone, I was like, I'm going to be a doctor because I couldn't think of a better thing to do than what I saw this pediatrician doing.
Yeah, that is such an amazing story. And I know now that we are all attendings and we all run busy clinics, it is hard to take that extra time to
Yes.
call for an interpreter, and especially when you're running behind and there's tons of patients. So I'm so glad that she did that for you. And I would feel the same way about anyone who does that for my parents, my mom specifically, who's not
Yeah.
as comfortable in English. So that totally makes sense why she would inspire you. And how
Mhm.
did you end up deciding on ophthalmology?
Yeah, so I went to Johns Hopkins for undergrad, as you mentioned, and I came in with biology. I knew I wanted to be a doctor for a long time. Biology felt like a good fit for pre-med, and I ended up really enjoying neuroscience. I think the brain and how we process things and what I believe is our universe, our mind, is just so fascinating. And in trying to get those pre-med exposures, I happened to join a lab of a retina specialist, and so maybe it sparked even my subspecialty in that I really enjoyed learning about how we process vision, how it impacts us, and its effect on really everything that we do, including our quality of life. And so I came into medical school really primed towards loving neurological subspecialties. I kept a very open mind. I loved a lot of things, including dermatology. I was debating with that and with ortho and with ENT. I loved a lot of things.
I remember.
But in the end, I think the combination of having surgery, but also having long-term patient relationships, also having fantastic mentorship with other people that seem to be able to develop a career, but also have a good work-life balance and have a family. I felt ophthalmology just kind of drew me in.
And ophtho is an amazing field. Like, I was
Mhm.
pre-ophtho for a really long time until I very last minute switched into derm. But ophtho has always had a special spot in my heart. And not only did you do ophthalmology, then you continued onwards to do a retina fellowship. And I remember you
Mhm.
telling me that this is a very male dominated field.
Mhm.
And I just want to talk about that for a moment because I've known you for a long time. I've known you through med school, residency, and fellowship. And I know there's going to be so many different answers to this question, but what do you think are some of the hardships that you encountered as a woman in a male dominated surgical subspecialty?
My interest in retina was truly loving seeing the retina, operating on it, fixing it, and the neuroscience. So I was drawn there for what I think are the right reasons. And it's sad that there are these barriers, because retina is, at the time when I was applying, it was about 90% male, and currently it's about 83%, particularly if you go into surgical retina, which is what I ended up doing. And so I felt it and I saw it as early as even medical training, that the way that you look, people start kind of pinning a specialty on you, and they don't even know anything about what your interests are, what your passions are.
Yeah.
The number of times somebody kind of assumed that I was going into plastic surgery, I can't even tell you. And so I kind of tried to like shake that, but there are other elements to it. It's a high emergency specialty. It's a high surgical volume specialty. And so I don't know if there's an element of people will only pursue what they see, and so if they see all men, I think maybe the women are less likely to do it. But of course, there may be some selection on the other side as well. So there's just kind of these challenges that you see in all these fields, whether it's medicine or beyond, where if there's no women there, it's harder for new folks to break in, particularly if they look very different from the typical. But I was fortunate to have good mentorship and I guess some determination, and just not willing to accept the status quo as it was. But I do think there would have been easier paths to take.
Yeah, no, I remember some of the stories that you told. And it is true, sadly, that I think appearance often shapes how mentors and others think of you and your potential.
Mm-hmm.
And in your medical training process, did you ever feel like you had to fit a certain mold, like you had to dress a certain way or look a certain way or suppress a certain part of yourself or your personality in order to be more acceptable in the field that you wanted to go into?
I would be surprised if anyone didn't feel at least a little bit, but I certainly think that the more different you are than the norm, the more you need to, in some ways, conform. And I really grappled with that early on, because in some ways it does help you move forward, but in other ways you're not being entirely true to yourself. And so as my career has progressed, I've become more and more just true to who I am, even if it's very different. And, luckily there is some momentum towards authenticity and diversity initiatives, but there's still a long way to go. And so I certainly did have to adapt some parts of myself that now I purposefully bring out, particularly as I'm mentoring young women or minorities, or just like anyone that's not fitting the typical mold. I take the initiative to bring that up rather than wait for them to bring it to me, because I know that it's a hard conversation to have, or it's difficult to do, particularly when there is a power hierarchy involved.
Right. And I mean, you are really changing the landscape for young women and minorities in your field. So I think it's exactly like you said. You need to see people who are different from the typical, retina surgeon in order to feel like, hey, like maybe I could see myself there.
Mm-hmm.
And one thing that you said earlier is just so classic Natalia Calloway, which is that you don't just conform to the status quo and you're always challenging the status quo. And
Mm-hmm.
one thing that I never, understood how you were able to do was to have a child during an extremely busy year in your ophthalmology residency at Bascom Palmer. And
Mm-hmm.
for people who are not in medicine who might be listening, could you explain like what a residency schedule might look like the hours and the shifts, and then talk to us about what it was like to have your first child during residency?
Yeah. So, A residency is a very demanding time. And, I think all residencies are very demanding. I went to a surgical program that was exceptionally demanding.
Probably the
And
most intense ophtho residency in the country, in like
yes, I
the
think
world.
that's pretty much the reputation, and it's a good training program. So I will say I still adore the program, but yeah, it's 100% work. Kind of a normal schedule is 6 days a week, 6 to 7 a.m. until you finish, and finishing can be 8, 9, 10 p.m. And then on top of that, you have a 24-hour shift every week. And then on top of that, you're still studying for your exams. You have presentations. You have other things you need to be doing, like application preparation and job searches. So it is really, I would say, at least 100-hour, 80 to 100-hour weeks. And it's very stressful, very intense. There's no breaks in there. You are working, you're seeing a lot of patients, and they're training you incredibly well, but it is not for the faint of heart.
That's absolutely correct. I remember you telling me that you guys even had an eye emergency room, and you even had like
Yes.
an inpatient unit for
Yes.
ophthalmology patients, which when I heard that, that blew my mind because, as dermatologists, we're consultants in the hospital, but,
Yeah. That's how
and
it
despite
usually is
that,
for ophthalmology.
right.
Yeah.
But despite that, you were still able to have a kid in residency. So, what did your maternity leave look like? What kind of preparations did you have to make in order to take that leave?
Yeah. So I think I had a few great mentors tell me that there's no good time in a career to have children. So have children whenever it's right for you and your partner. And I am so grateful to those people. And that's what I tell others as well. Because now I've had a child in residency, in fellowship, as a clinical attending, and now I will in industry. And there are challenges at every stage.
Mhm.
Um, so we knew we wanted a family. We knew we wanted a big family, right? So at some point you have to get started, and the medicine timelines don't necessarily align well with the biological timelines.
No.
And in my second year of residency, which is in our third year, is typically where you kind of have your bearings a little bit more. You're less learning and you're more doing, because you've acquired so much knowledge. And you do have a few electives that you can choose. And so we decided that we wanted to start a family. I think I was the second person ever to get pregnant in that program. And I see why. It's pretty crazy.
Oh my gosh. Talk
And
about breaking
yeah,
barriers.
yeah. I had the conversations. We were fortunate to get pregnant, which is a whole, another realm. And but it's hard. I'm not going to sugarcoat it or deny it. It's you're working a lot while you're. I was very sick in my first trimester, and then later you're very big, as I am now. And then I was able to take 6 weeks of maternity leave during residency, but at the time, 6 weeks when I was working that hard felt like, oh wow, that would be so much time. But now that was before I had kids and realized that's not that much time. Um, and coming back, I think probably one of the hardest things I've ever done in my life is go back to residency and try to maintain pumping every 2 hours, every 2 to 3 hours. Because when you go back that early, baby's still eating, so frequently. And it's something that I don't think I would even have the energy to do now. Like I did it when I was 29. But on the other hand, I'm so grateful I have my daughter, and that, and that everything worked out. But it was certainly a very challenging period.
Yeah. I mean, you certainly also helped set an example for others who came after you in the program, for other women who were thinking about having kids and were like, you know what? I probably just can't do it because no one's done it before. So you really
Yeah.
show that it can be done, even though it's very, very difficult. And then you had a baby in fellowship, which had its own challenges, and then as an attending, and then now you're pregnant as working in industry. And
Mhm.
congratulations. It's so
Thank
exciting.
you.
I can't wait to meet the new baby. Our babies will only be a month apart. It's really exciting.
I know. I
Um,
know. I'm so excited. I think it does set the example. It goes back to people seeing it and realizing it's possible. It's not easy, but it's possible. And since then, there have been many others in both my residency and my fellowship. And I get these calls occasionally from all across the country. So it's funny how this kind of it disseminates and hopefully in a positive way.
Yeah, and I hope that going forwards, there will be more support for women who are trying to have kids at all stages of medical training, because as we know, infertility is a huge issue for women in medicine, something that I experienced myself. And I think just a lot more education, resources, and support needs to be available for us, even when we're trainees.
Yeah, and I think unfortunately somebody does need to be the one that goes through it. So I was the first in my fellowship ever to get pregnant. And
Wow.
the and this, so there were a lot of conversations about what I need. I need a room to pump that has a fridge and setting that up. But now that's set up,
Yeah.
and now multiple fellows since have used it. So I think it's one of those, it's important to do. It's hard to do, but I think it's important to do because once somebody sees that happening, they realize, like you said, it is possible. And now the infrastructure is there. They're like, oh yeah, that's the room that Natalia would be pumping in. Let's set that up again. And it's not as hard the second time around.
Yes.
Um, and there's just more awareness, like, oh yes, okay, she'll pump for 6 or 9 or 12 months, however long it is, and it's not the end of the world, which is
Yes.
really not.
You showed everyone that it's possible. And I do want to be mindful of your time because I know you have to run off to care to pick up one of your kiddos. But there's
Hmm.
so many things I want to ask of you. And I feel like we'll need to do a part 2 of this because I also want to discuss a whole nother topic, which is transitioning to industry and how that whole
Mm.
second part of your career has been. But for today, I think one thing that I would love to wrap up with is to hear about how you make it work with 3 children, a full-time career. You're still seeing patients at Stanford as a clinical instructor, and your husband works too.
Mhm.
So how do you make it work, Natalia?
Well, probably the same way that you do, Joyce. I think ruthless prioritization. I'm really vicious with my time, and I say that encouraging others to do the same, because there's so many asks on your time. But in the last few years, I've been very clear with myself, actually written it down what my priorities are, and I make sure and I check in around quarterly on my calendar that my time is reflected the way that I want it to be. And so there's things that I care about a lot, and there's things like picture perfect, like cooking of home meals, or that it's not that important to me. I'm not a chef. I've never had a passion for it. And I happily outsource it. But I do think it requires a lot of conversations, friends, community, support network. We do have a nanny. And there's also it's very dynamic. So there's some days where I'm very much playing the industry leader role, and I'm in a suit and I'm working very hard in that place. And there's other days where I'm volunteering at the preschool and I'm doing the Play-Doh station, and so I kind of like shift between these roles. But I just make sure that overall I'm kind of setting myself up and my time in alignment with what fulfills me most. And for me, that's family and friends and developing fulfilling work, but also letting go of the things that maybe used to weigh me down, like the perceptions or the thoughts of others or the prestige or the gold stars and the awards. and really focusing on what's most important to me now.
I love that. Oh my gosh, I love that. And I think that's a lesson that a lot of women that I've talked to, both for this podcast and just as friends, it's a lesson that a lot of us are learning and learning to really reprioritize everything because in all of medical training, we're taught to say yes to every opportunity, oftentimes
Yes,
providing our time for free.
usually.
And now that we're on this side of it, we really can say no more often and focus on the things that actually matter. And I don't know about for you, but for me, definitely when I decided to make that shift to opening my own part-time teledermatology practice, I did feel a lot of judgment, or maybe I perceived that there would be judgment.
Mm-hmm.
And I thought people might be disappointed in me for taking a more non-traditional route. But at the end of the day, I remind myself that other people's goals are not my goals.
Exactly.
And I just need to be clear on what my priorities are. And so it's very, very refreshing to hear you say that and put it so eloquently. So, Natalia, we're going to have to do a part 2 if you're
Let's
open
do
to
it.
it.
Yes, I would love to. Let's plan a part 2.
Yes.
I know one of the questions you had asked was, do you have any regrets? And along those lines, I think I wish I had come to this place of peace with my priorities and my goals sooner. I think it took me longer than I'd like to admit, where I really was weighed down by the judgments and opinions and priorities of others. And I've come to realize that the people that love you like you, they will support you no matter what. That's kind of your village. But in terms of living your life and your priorities, I mean, you can really just stretch yourself completely too thin trying to please everyone else. And then that means that your own goals get put to the side. And I do think for a while I was in that place. And now I've much more come to, well, I understand and I respect. I wish I could do all of this, but there's only so many hours in the day. And I enjoy sleeping and being with my husband and playing with my kids and taking care of myself and my health. And
Yeah.
that's okay. And there's also, there's more time and, there's a future there. So, it may be that right now we're in the young kids phase and we're very demanded at home, but when they're 13, will they want us every minute? I don't know. I hope so, but I don't think so. So yeah, I would be happy to keep chatting about this because I think it's so important. And for me, it's been a big change in my mindset on a lot of
Right.
these things, both on the career front and the family front in the last few years, really. And it's required some intentional thought on the topic. It didn't just kind of come to me or fall from the sky. Like I really needed to sit down and reflect with myself and my family um, and just where everything was going with what do I truly want and what makes me happy.
Yeah. And that's something that we don't necessarily have time for as trainees
Yeah.
to think about that because you're just like, I have to do this, this, and this in order to get to that stage. And you're always like, once I get to that stage, I'll be happy.
Yeah.
Once I get to the next stage, then I can relax and focus on other things in my life. But then you realize, 15 years have gone by and you're like, what am I doing still with this delayed gratification? Like the time is now.
You get
So
to
I
the
think
next stage and you realize there's another stage. And
there's
there's just
never ending
always another
stages.
stage.
There's always another stage. And so I hope that by having conversations like this, we can show young men and women too, that it doesn't have to be that way. So
Yeah.
I definitely am looking forward to a part 2. And thank you so much for your time today. I miss you and I can't wait to see you again in person. And thank you so much for coming on here and being so honest and vulnerable with us.
Oh, thank you so much for having me. I very much look forward to part 2 and congratulations on the podcast and all the success.
Thank you. All right. Bye.
Bye.
Thank you for joining us today for our real, unfiltered conversations. If you haven't already, don't forget to hit subscribe on your favorite audio podcast platform. And if you're more visually inclined, all of our video podcast episodes are available on my YouTube channel at Tea with MD. For more beauty and skincare content, don't forget to check out my Instagram and TikTok at Tea with MD. Remember, life isn't just about the curated content we see on social media. It's about these real conversations we have with each other. So continue spilling the tea with your friends, family, and loved ones. And together we can create a more open, connected, and authentic community. Until next time.